show. This one's for the warrior. Yeah, one time for the warrior. This one's for the warrior. Yeah, one time for the beyond the show. This one's for the warrior. Yeah, one time.
Hi, I am Tabitha McGee. Welcome to Beyond the Show. This is a companion podcast to our TV talk show, Unveiling Sickle Cell Beyond the Pain. I'm really excited about being here today because we're going to do many different things. We're going to talk about many different things. We're going to smash the stereotypes and the stigma associated with sickle cell disease. We're going to have this phenomenal young lady that is on who's a fierce advocate to talk about sickle cell disease and the important mission of her organization. But before we get there, here's what I want you to do. You see this like button? Like it, share it, tag us at sicklecellga.org. Share this with everyone that you know, your friends, family members, your colleagues at work, and even people that you don't know. Just share it publicly. We would really appreciate that. And become a member of our tribe by subscribing to this channel as well. So we will go ahead and get started with the show. So I first want to tell you about Gwen Morgan. She is a phenomenal individual. She is a caregiver of a warrior herself. She has this organization called Lockheed Martin. And I cannot wait till you guys hear all the phenomenal work that she's doing out in the marketplace. So welcome, Gwen.
Thank you.
I'm
Tabitha.
so excited to have you here. You and I have, I've been around 10 years now. You've been around much, much longer than I have.
Almost 20.
Almost 20, okay.
Yes.
What year did you found your organization?
2000, maybe 4?
2004.
Yeah, 4.
Okay.
5, yeah.
Okay.
A little bit. It started off with like just a birthday party.
Okay.
And then I would donate proceeds from my party to the Sickle Cell Foundation of Georgia.
Okay.
Then I came up with the concept, well, I'm going to start a foundation
Okay.
to give extra help to the foundation.
And you have done that. You have been one of our fierce partners in this space, really helping, share the knowledge, the awareness, the education. But before we start talking about your organization, I want to back up a little bit.
Okay.
You have a personal reason for being in this space. Do you mind sharing this?
Yeah. I have a son. He's 35 now.
Okay.
He was born with sickle cell.
Okay.
He was the first in the family.
Okay.
I had no knowledge of sickle cell. I knew of sickle cell,
Okay.
and I was tested in high school, so I knew I always carried the trait.
Okay.
But my ex-husband did not know he carried the trait.
Oh, wow.
So I decided I needed to not only educate myself, but my family and my friends because of my son. So I started the foundation, Gwen Morgan Foundation, and I wanted the disease not to be the forgotten disease.
Right.
Because no one in my family was aware of sickle cell.
Wow. Wow. That's why we keep telling everyone, know your status.
Know your
right?
status.
Know your status. Get a sickle cell test immediately.
Correct.
Everyone needs to get tested, and you can get tested right here at the Sickle Cell Foundation of Georgia by going online to sicklecellga.org. Know your status. It's critical that you know your status. You remember back in the day, Gwen, when you could go to the courthouse and before you got ready to get married, you had to have a blood test, right?
Correct.
And you would find out anything that was going on
Correct.
by the blood test. Well, they've taken that out now. It's no
Correct.
longer mandatory.
Right.
So people are getting married not knowing their status.
Not knowing their status. And I actually found out in the 9th grade because
Okay.
they came to my high school
Oh, wow.
and they tested everyone in my high school.
Okay.
So I knew in the 9th grade that I carried the trait.
Where did you go to school?
Gordon High in Decatur, Georgia.
Gordon High. Okay.
It's now McNair.
McNair. Okay.
Yes.
So I went to Lakeshore High School here in College Park, and I don't ever recall them testing us. However, when I went into the military, they did test us there.
Okay.
And it's very important because, like you said, you always knew your status.
Yes.
But your ex did not know his status. Did you ask him, though?
I didn't. I never thought about it. I knew, well, I carried the trait. He never said anything. And then we found out my sister carried the trait.
Okay.
But I have an older brother.
Okay.
He does not carry the trait.
Wow.
So then I went back and did more research to find out where I got the trait from.
Okay.
And I received it from my father.
Wow.
Because my mother doesn't carry the trait.
Okay.
Yes.
And so that's critical. I met, should I say, a couple who had 4 children. They both knew they had the trait, but no one had educated them on what the significant importance of understanding, getting education about the percentage,
Correct.
25% chance that you may end up having a child with sickle cell disease.
Correct.
So even if you have sickle cell trait, You still need to have the education behind it, and make sure you ask your partner, do they know their status? And if they don't, come to the Sickle Cell Foundation of Georgia to get tested. So let's talk about your organization now.
Okay.
Tell me about the mission.
Our mission is not only to educate, but to help families that are in need.
Okay.
So I partnered up with CHOA,
Okay.
Children's Healthcare of Atlanta,
Okay.
and I talked with every social worker at the different locations at that time. And what I did was ask them to refer people to us that were
Okay.
in need.
Okay.
So that is how I started. And then as we grew a little bit more, I just made connections with people that suffer from sickle cell. And I would ask them, hey, if you know of a family that is in need that you may know, refer them to us. Let us
Wow.
help them as much as we can help them.
What are some of the resources that you provide for individuals in need?
So we provide, we actually changed it up a little bit.
Okay.
So we provide a gift card.
Okay.
And that gift card is for utilities,
Okay.
gas, grocery,
Okay.
whatever you're in need of.
Okay.
That social worker will contact us
Okay.
and say, I have a family, the Jones family. They're in need of assistance with rent this month. That gift card goes to that social worker
Okay.
and she gives it to the family
Oh,
to
wow.
support their needs.
That's a powerful service that you provide. And I'm so glad we're partners.
Yes.
You know, I'm so
Yes.
glad that we're partners. We came together, I guess now, it'll be 4 years in October. Yeah, 4 years since I've been the CEO. So we've come together and now we're sharing our resources. So now we can share that with many more warriors
Exactly.
opposed to just trying to do it individually.
Correct.
And that's why I believe in the power of partnerships and collaboration.
Exactly.
You know, I know a lot of people like to hold on and, you know, it's all
No.
mine, but we get so much more done when we're
Yes.
together.
Yes, and then it may be a position where I'm not able to help,
Right.
but someone else that has a foundation.
Yeah,
I can reach out to them and say, hey, are you able to help this family?
absolutely.
I'm not able to help at this time,
Okay,
but I can get the next family.
absolutely.
Yes.
Where does your funding come from?
My funding come from, I have 20 young women that
Okay.
work with me,
Okay.
and they're called my Circle of Hope.
Oh,
And my Circle of Hope, we raise money throughout the year with different fundraisers. We also reach out to family,
Okay.
friends that may want to donate to the cause.
okay. Oh,
that's
that is so awesome.
Yes.
Tell me about your role as an advocate. What does your life look like on a day-to-day as an executive director of your organization?
Busy. Because everything, that's why you have to have people in your corner to help you.
That's right.
Because you're only one person, you can't do everything.
Right.
So that's why I rely a lot on the Circle of Hope to help me navigate through some of what may be going on at the time. So day to day, it may be 5 phone calls one day.
Okay.
It may be no phone calls one day.
Okay.
We may get 10 the next day. It just depends on, it's just the day to day.
Yeah. Wow.
But we strategize starting at the beginning of the year
Okay.
to put our calendar together and to see what fundraisers or events that we're going to host throughout the year.
Yeah. I love that circle of hope. You know, we were
Yes.
talking earlier about the power of having a community that supports you.
Yes.
And, you know, I share my story about, you know, overcoming a heart attack and a stroke and how my community showed up for me. You know, my
Yes.
friends were here. They flew into Atlanta a week at a time to help nurse me back to health. And so it's so important to have a community and that circle of hope that you're
Yes.
talking about. And I'm glad that you have that available to you.
Yes.
Yeah. Tell me about some of the stereotypes and the myths that persist about sickle cell that you hear of.
Drug seeking.
Yep,
Drug seeking, that just breaks my heart.
it is.
And not receiving adequate care in the ER. And the long waits in the ER, especially with the close of different hospitals now, the wait is even longer.
Yeah,
And a lot of the warriors refuse to go to the ER
right,
because of the wait
right.
or the stigmatism of they're just drug seeking.
Yeah. You know, NIH has a protocol for the emergency rooms for when our sickle cell warriors show up. And it amazes me that today that the NIH protocol is still not being adhered to by so many different hospitals.
Correct.
And I just had a hospital, Hillendale, Emory, and they told me that they have a third-party organization that runs the emergency room. And they were so thirsty for the knowledge about sickle cell. And it's like, Tabitha, when can you guys come in and do provider training so you can teach us exactly what we need to know about sickle cell? So they want to help. They just didn't know where to start or who to reach out to. And so we just signed an MOU with them. And I'm really excited that we're going to do that provider training. And I guess that's where we need to start. That's our starting point, is just to go to every single hospital.
Correct.
Go to the emergency rooms.
Correct.
Making sure that we're printing out a copy of the NIH protocol.
Yes.
And telling them how they should treat our sickle cell warriors.
Right. And hospitals can actually share information.
They can share information.
They can share information.
Yeah, they share it all the time, don't they? About the patients.
About the patients. So they can share information on sickle cell.
Absolutely, they can.
Mm-hmm.
So your son has reached the age of 35.
35.
That's huge.
Yes.
That's very, very huge. How do you feel about that?
I'm excited. He recently got married.
Wow,
So
okay.
he's married and
Congrats.
he's a stepdad now.
Okay.
So, because by him having sickle cell, he didn't want to have kids of his own.
Okay.
So I'm excited. He actually left the state. He moved to North Carolina.
What?
Yes.
So are you here by yourself now?
I'm by myself.
Welcome to singlehood.
Yes. Absolutely.
Wow.
Yes. So he's managing well.
Okay.
He's partnered up with Duke in North Carolina.
Okay.
So he receives his treatment through them.
Does he have SS?
He has SS.
SS, okay. So he has
Yes.
SS. Yeah, that's huge
Yes.
for him to be 35 with SS.
Yes.
Lets you know that he's taking good care of himself.
He's trying.
Yeah,
Yeah.
yeah.
Yes. So, and he has a cousin with SC,
Okay.
but she lives here in
Okay.
the state of Georgia.
What would you say was the toughest moment as it relates to having a warrior with sickle cell disease?
I think the loneliness.
The loneliness.
And because I was the only one in the family with a child with sickle cell disease, I just always felt lonely
Oh,
by myself.
I'm sorry.
Yes, because I just didn't have that connection at the time
Yeah.
when I first started out.
Yeah.
And I think I kind of pushed myself away from people
Okay.
because
They didn't understand.
they didn't understand.
Right.
And then I started to surround myself with other mothers.
Okay.
And that's one of the events I host once a year, is a sickle cell mothers luncheon.
Oh.
Where it's just sickle cell moms. We all get together, we have lunch, we talk, we collaborate, we meet one another. I said, because you may be in the ER when she's in the ER.
Right.
Your child may be in the hospital when her child's in the
Yes.
hospital, and you have each other.
Oh, I love that. And I saw the beautiful pictures of the ladies on Facebook
Okay.
during your lunch. I was like, this is so beautiful. It's such a beautiful
Yes.
moment. You guys look so cute and pretty. I was like, oh,
Thank
that's so,
you.
man. So you have another circle. So the circle of the
Yes.
mothers.
Circle of the mothers. And
Yes.
I keep in contact with a lot of them.
Okay.
And they may need resources, or they may need, someone else may need resources.
Right. We just put together a SCFG Care Bear team. And the purpose of our Care Bear team is that when we find out a warrior's in the hospital, one of us on the team can go and visit, or two of us go together, and we have these kits that we deliver, you know, they're essential items that they're going to need. And so, again, it's just all about partnership and collaboration.
Exactly.
Mm.
And knowing.
And knowing.
Yes.
Share some truths about living with sickle cell disease. What do people need to know?
First, that you're not alone.
Okay.
There is resources out there. And I think healthy living, taking care of yourself, making sure you're eating properly, making sure you're getting the rest that you need, and you're taking your medication.
I was talking to someone earlier, and we were talking about how important it is of what you eat, right? What you're consuming. And we were talking about the water, hydration, but we did not talk about sleep.
Yes, sleep.
And that's so important.
Very important. They have to get their rest.
That was part of one of the reasons for my stroke, is because I thought I can live off of 3 and 4 hours of sleep.
See?
And I was stressed, and I was moving a million miles a minute. And my doctor was like, this is all stress related. I'm like, wow, not getting enough sleep. I'm like, well, I've always done 4 and 5 hours. He's like, yeah, but you're not that 20, 30-year-old anymore.
Exactly.
And I definitely don't have a chronic disease. So, yeah,
Yes.
I'm glad that you said that sleep is so
Sleep
crucial.
is very important.
Yeah,
And maintain that stress level, as much as possible.
yeah. Okay.
Yes.
Sleep is critical. I just thought about
Very.
it. Yeah.
Very.
So I have on my Oura Ring,
Yes.
and it tracks my sleeping.
Okay.
And so I can absolutely tell the next morning when I look at the phone, the app, how I feel based on how many hours of sleep.
Correct.
And I was just like, oh, I feel incredible this morning. Oh, I'm really dragging. I'm tired. And I look and it's like, oh, you only got 5 hours of sleep or 6 hours of sleep. But when I do 7 to 8, I feel like I can conquer the world.
Exactly. You feel rejuvenated.
Yes, rejuvenated. The one thing about sickle cell, too, we're talking about truths, is that sickle cell doesn't have a look.
No.
They look like everyday, ordinary individuals,
Exactly.
beautiful, talented, educated. And so they are often overlooked because it doesn't have a look.
And it doesn't have a time.
It doesn't have a time.
You could be well in the morning and sick in the afternoon.
Yep.
And in the ER by night.
By night, yeah. That is so true.
Yes.
What do you think we can do to help with the paradigm shift as it relates to these doctors who are not providing the best care to our warriors?
Education.
Education.
Education. We have to keep talking. We have to keep talking. And, you know, I also feel like when they're in medical school,
Yep.
sickle cell should be on the top tier, just like cancer.
Yeah.
You know, they don't get enough training on sickle cell.
You know, I also thought about when you just said that, when they're coming out of medical college, right? And they're
Yes.
going to hematology for oncology, there's a
Yes.
lot of money.
There's a lot of money.
But when they do hematology for sickle cell,
There's no money.
there's no money. And so there's like, I've been out trying to recruit them. It's like,
Right.
we got like $400,000 of, student debt.
No, we got to pay off.
We got to pay off. So I'm sorry, as much as I want to help our community, I got to go where the money
to the other
is.
side. Exactly.
Yeah. Mm.
Exactly.
Yeah.
Yeah.
What are some call to actions that you feel like we need?
The awareness
The awareness,
is number one.
number one.
And during sickle cell month,
Mm-hmm.
it needs to be sickle cell month. It needs to be to the forefront. It needs to start September 1st and end September 30th.
Yes.
That all we're talking about is sickle cell.
Yeah.
Sickle cell.
Yeah.
That's our month. Let's talk about our month. It should be in the schools.
Yep.
It should be in the colleges.
Yep.
It should be in the hospitals.
Yep.
Posters up.
Yep.
It's Sickle Cell Month. National Sickle Cell Month.
Call to action. I
Yeah.
like it. I like
Yeah.
that, Gwen.
Channel 2511. It's Sickle Cell Month.
It's Sickle Cell Month. That's right. And it's right around the corner.
Right around the corner.
This year is flying by, isn't it?
Yes.
Geez, we're almost out of July. And so if you're listening, our call to action is support a sickle cell organization in September. Sickle Cell Awareness Month starts September the 1st all the way through September the 30th. Inside of that month, Gwen, you do something very important.
Yes, I do.
What do you do?
I host a gala, and it's called the Red Shoe Gala. But we actually took a year off because we've been doing it so many years. This year, we're having a luncheon. It's our scholarship luncheon. And we're going to give out 10 book scholarships to seniors that are going on to college as a way of paying our homage.
Okay.
Yeah, we want to give back.
Yeah, we want to give back.
And we want them to go beyond high school.
So the scholarship luncheons that you're having, the 10 that you're selecting, are they all, they have to have sickle cell?
They have to have sickle cell.
Is it sickle cell disease, sickle cell trait, or just sickle cell disease?
Just sickle cell disease.
Okay, I understand
Yes.
that.
You can have a trait,
Okay,
but we prefer those with sickle cell
I understand.
disease.
That's the same way we are about camp. You know, we just
Yes.
sent our children off to camp just recently, and same thing, they have to have sickle cell disease in
Yes.
order to attend the camp.
Yes.
So we're talking about the month of September for sickle cell awareness, and we have this incredible 5K road race walk as well, and I'm really excited about that. And so, again, it's all about awareness. And what people don't understand, I remember I was at this Black legislative dinner, and they was like, sickle cell, Tabitha, we thought was cured. We don't hear anything about sickle cell anymore.
Correct.
Well, you don't hear about it because we don't have the marketing advertising dollars that other large organizations have.
Correct.
And so the way they can keep the information in front of you, you know, when I think about commercial right now, I'm thinking about McDonald's, State Farm, Allstate, all these different insurance companies, you know,
Correct.
the big billboards that we see. Unfortunately, the monies that we receive in, we use that money for direct services back to our sickle cell warriors, right?
Correct.
So that's why this talk show and this podcast is so incredibly important. It was one of the ways that I wanted to bring awareness and education to sickle cell by doing the podcast and by having our talk show so that people can understand more about sickle cell disease, but understanding too, it takes a lot of money for advertising and marketing.
Exactly.
And we just don't have those type of funding.
We don't have the backing.
Yeah, we don't have the backing.
That's why we got to keep talking.
We got to keep talking.
We got to keep talking.
Got to keep talking.
And we got to prepare the next generation.
We sure do.
They got to keep talking.
Absolutely.
So that 10 years from now, we don't have to keep talking about sickle cell.
Absolutely. Absolutely. It'd be a mainstay, you know,
Yes.
inside the community.
Correct.
We have so much work to do, Gwen.
We do.
And you would think, so you've been here over 20 years, I'm here 10 years, and you would think that it would be easier now or the load would be lighter.
Right.
But I feel it's just as heavy as I did when I first started.
20 years ago.
Yeah.
For me, it's the same.
It's the same.
It's the not knowing. I call it the forgotten disease.
Would
They kind of
you-
forgot about us.
Would you say it's forgotten because the majority are African Americans that's impacted by
Exactly.
it? That's sad, isn't
Exactly.
it?
Yes.
You know Jackie George, right?
Yes.
So she's been at the foundation 46 years, and it'll be 47 this year. And she brought up some statistics about cystic fibrosis and hemophilia and how they have fewer instances of individuals living with those two diseases, but it gets so much more funding.
So much more funding. It's talked about.
It's talked about.
Yes, it's talked about.
We're going to get some people who have a lot of funding.
Yes.
Tyler Perry,
Exactly.
Oprah Winfrey,
Exactly.
to help us. And they should.
Shaq.
Shaq, yep, Shaq.
And let's start with the local ones.
The
that live
local
here.
T.I., all of our
T.I.,
musicians that we have here.
Exactly. Let's start with them.
Let's start with them. I wonder why they haven't been a big advocate for us yet. Maybe no one have
No
asked.
knowledge.
No knowledge.
So let's have us a gathering.
Let's
and
have a
they're
gathering
and they're invited.
and invite them and then educate them.
Right. And let's talk about sickle cell.
Yeah.
And why we need you.
Right, because Tyler Perry's right down the
Right
street. Right down the street. We're probably gonna walk to the studio.
Exactly.
Yeah, we got some work to do, but we're gonna do the work.
Yes, we are.
We have a great team of us. You know, me, you, Mapilla Don, Dr. Mitchell. We have Dr. Bailey, who's in this area.
Yes.
We also have Angela Shepard, Mia Robinson,
Correct.
Crystal Stone. Am I missing anybody? I hate to call.
'Cause
Oh,
I've
Lois Williams.
Because I've worked with Mapilla
Yep,
and
Mapilla.
Mia a
Yeah.
couple of times.
Okay. Yeah, so we got some wonderful individuals right here in the
Yes.
state of Georgia that's doing some incredible groundwork.
Correct.
We the boots on the ground.
Yes, we are.
So I need to learn how to do that boots on the ground song. Pop, 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 pop.
Exactly.
I'm so thankful that you're here. I'm
Thank you
really
for having me.
joyful that your son is doing well.
Yes.
I am thankful that your organization is doing well
Yes.
and that you're thriving. So now we got to find you some dates because you're single.
Exactly.
Yeah, we got to find you. Look, girlfriend, I understand. You know, we got to find you some dates. You're
Yes.
empty nester.
Empty nester.
You know, empty nester. I think there's a lot of us that are empty nesters that's
Yes.
single out here, right?
Yes.
We got to find us some dates to go out and have a good time, celebrate all this great work that we're doing. And then hopefully our partners will join us and help us too,
Exactly.
you know. So thank you so much for being
And
here.
thank you.
Are there any closing thoughts you want to leave everyone with? And if so, let's hear them. Let's tell us about your closing thoughts.
I think my closing thoughts would be we can't stop fighting. The fight continues. So as long as the fight continues, we're going to fight.
I love that. That's what Martin Luther King
Yeah.
Jr. and his whole team did. They
Gonna
didn't stop
fight.
fighting.
No.
They marched, they protested,
Yes.
and we have to keep fighting.
We have to keep fighting.
Yeah.
We have to support each other.
Yes, for sure. I love supporting people. I love helping people.
Yes.
It's one of my gifts. The gift that keep on giving.
Keep on giving.
Well, I'm going to
Exactly.
continue to give, and I know you're going to continue to give to the
Exactly.
Warriors, and I know the Warriors are very thankful to have you. Yeah, so thank you for all
Thank
that you do for
you.
them. You're welcome. So if you are listening, I know you've learned something today. there's some takeaways from this podcast that you guys are hearing from Gwen Morgan. And as she said, we got to keep fighting. And believe it or not, there is hope in every heartbeat. And so we have hope for our warriors. We're fighting for our warriors. And if you're a mom and you're listening to this podcast today and you feel lonely, reach out to one of us. You are not alone in this fight. If you're a warrior and you feel like I am alone, you're not alone. We're right here and we can provide you with some phenomenal resources, and we want to. We want you to go to our website at sicklecellga.org. Gwen, what's your website?
It's Lockhart Morgan Foundation.
Lockhart Morgan Foundation. Go to her website as well. And again, we're here together to share this great news, this great word. And we have a lot more awareness that we want to share with you, a lot more education we would like to share with you. And don't forget, tag someone at sicklecellga.org. Tag us, tag someone that you know, tag a colleague, a friend, family member, everybody. Share this. And then don't forget, like right here, subscribe to this channel as well. And remember, there is hope in every heartbeat. My name is Tabitha McGee, and I'll talk to you later.
You need to get this on.